Hello, welcome and everyone, and I am Professor Dr. VR.SUBBIAH. I'm a senior consultant diabetologist and senior professor of pharmacology. I'm very happy to see all in this channel, Pharmacology. And this channel is basically started for clear understanding of pharmacology for the medical students, dental students, for those who are doing their undergraduation, post-graduation as pharmacology as major, and those for general practitioners and for other people who are interested in pharmacology. And I'll be sending a series of videos for your clear understanding of pharmacology. So pharmacology is a very interesting subject and is a basis for all the medical treatment. So without pharmacology, you cannot prescribe medicines in medical field. So here is a few lectures which I'm going to give you. Is going to give a clear understanding of pharmacology, and is going to be very useful in your practice and for your studies as well. So pharmacology is a Greek word. Is a pharmakon and logos. Pharmakon means drug. Logos means discoursing. So it's a science that is going to study about the science of substances used to prevent, diagnose, and to treat the diseases. So prevention, as we are using vaccines. So this is again a pharmacological substance. So it may be used for prevention of disease. For diagnosis, we are using a number of dyes. Even some medicines are used to diagnose certain diseases. And we are using drugs to treat the diseases. So it's a science as far as it deals with substances used to prevent, diagnose, and treat that. It's a simple definition of pharmacology. Then there are two broad divisions of pharmacology which you are going to see subsequently. And they are this is pharmacodynamics and pharmacokinetics. Most of them, the people in the undergraduate, they usually mix up the word and they go in the confusion. So I'll tell you how to remember it. So pharmacodynamic. So it's a dynamics. Dynamic mean you will see a patient. We will say a person is a dynamic person. So it's always an action, an active action. So pharmacodynamic means the drug action, what the drug does to the body. What are all the changes the drug which we intake inside the body is going to make a change, like physiological, biochemical, and what is the mechanism by which the drug act is a pharmacodynamic. When you say a dynamic person is always an active person, how the drug is going to act. So you have to remember pharmacodynamic is the action of the drug. Then pharmacokinetic, when you see, what is a kinetic? Kinetic is always a motion. Now how the drug is going to move inside the body, it's pharmacokinetics. So pharmacokinetic, when you take a drug inside for treatment or something like that, so how the drug is going to travel inside the body. So it is going to get absorbed. You have to remember the mnemonic ADME, that is absorption, distribution, metabolism, and excretion. Nowadays they use a terminology called liberation. So LADME, liberation, drug absorption. Once the drug gets absorbed, how the drug is going to distribute in the body, all the parts of the body. So distribution, and how the drug is going to get metabolized, how the body is going to handle the drug. Then what is on which the drug that is taken should go out of the body. It is elimination. So liberation, absorption, distribution, metabolism, excretion forms the pharmacokinetics. So remember, pharmacodynamics is the action of the drug, and pharmacokinetics is what the body does to the drug. Then certain definitions pharmacology must know, both the undergraduates must know about this. So drug, a drug, from the word drug, it's a French word. So it basically drug means a dry herb. So the substance that is going to modify the physiological and pathological for the benefit of the recipients. So this is a drug, it's a drug. So pharmacotherapeutics means the other definition, that is pharmacotherapeutics. So use of drug for the prevention and cure of diseases, we usually tell the word pharmacotherapeutics. clinical pharmacology. This is a scientific study of drug in man. It's a clinical pharmacology. Clinically, how we are going to study the effect of the drug in human being, we call it as clinical pharmacology. So a lot of things involved. Clinical pharmacology is evolving as a big field after doing MD pharmacology. That's a DM clinical pharmacology. So then chemotherapy. So chemotherapy, the use of drug to cure the infection or to treat the malignancy, we call it as a chemotherapy. To treat the infection, systemic infection, and to cure the malignancy when we use a drug, and that phenomenon is called a chemotherapy. Then pharmacy. People often confuse this pharmacy with the pharmacology. Pharmacology, already we say this is a study of drug. So pharmacy is a preparation, the technological science. So these pharmacy people, they do a B form, a D form, an M form, or something like that. So they identify the drug, identify which is a drug, they collect it, they make a purification, they make standardization, they make compounding and dispense the drug. They have nothing to do with the patients to treat the disease, but they are the people who are preparing the drug, and in some countries like US and UK, they are the people who are going to write the dose of the drug and to dispense that particular drug to the patient. They may be working in a medical shop or dispensing pharmacy, and they are going to give the particular drug to the patient. So that should be prescribed by a qualified consultant. Yes. So these pharmacy people, they sometimes, you know, they have this a particular course called M.Pharm, clinical pharmacy. So they are usually attached with the doctors in advanced countries, and they also go for rounds in the clinical practice, and doctor will only tell the name of the drug. So put the patient on so and so, for example amoxicillin, and he go away. But the pharmacy people, they have to take the prescription, and they have to write the dose, they have to weigh the patient, and according to the weight of the patient, something like that, they have to write the proper dosage and schedule everything. That's also done by the people with the pharmacy. So that's the pharmacy. Then there's another terminology called toxicology. So as you know, toxin is a poison. So study of poisonous effect of the drug, and to detect the poison, to prevent poisoning, and also if at all the patient has taken poison and you had to treat it, so that's a reduction, prevention and treatment of poison, the subject called toxicology. Then the next topic is the source of the drug. Where are the drugs? We're using so many drugs in our practice. So what are the sources? So number one, natural, that is animal source. For example, heparin. Nowadays we are preparing a synthetic heparin. So nowadays whatever the drug mostly available in the market, and most 99% of them are synthetic. But in general, this is a history in general. Heparin was first taken from a leech, leech. So this leech, the saliva of the leech contained heparin. So only the leech, when get attached to the body of the human being or some other animal, they liberate this heparin and they suck all the blood. Heparin is anticoagulant, it prevents the coagulation of the blood. So it liberates the heparin and it prevents the blood from clotting, and sucks all the blood, and it becomes big. So next, the insulin is a typical example where those days, nowadays we have all the DNA recombinant technology insulins. In those days, insulin was first prepared, Banting and Best, and still, still in up to 80s, we used to have the bovine and porcine insulin. And bovine is taken from the cow or buffalo, and porcine it is from the pig. So they took the pancreas of the pig, they did a compound, and they prepared a filtrate, and they extracted insulin. The insulin was given to the patients. So nowadays we don't have such insulin because we don't want to kill the animals. As I say, in those insulin prepared from those bovine and porcine, and they are not pure. They don't match the human insulin. So a lot of adverse reaction like allergy, insulin allergy occur. So nowadays we are not using it, but as a history you must know. Thyroid, of course, the same like insulin, and other hormones. But nowadays as again I'm repeating, most of them and almost all of them are synthetic preparations. Then of course the genetic engineering, that's what I told you. So all the drugs like hormones like insulin, growth hormones, vaccine, everything is prepared by a genetic or DNA recombinant technology, the yeast and fungus, bacteria and yeast. So of course you can know this, what is the DNA recombinant technology. You can go with the advanced study, you can go through the books and you can study what is the DNA technology. Then minerals. So minerals, natural resources, minerals. So the zinc, which is used for as a metal for treatment of zinc deficiency, and aluminium hydroxide, which is used for all the antacids. The liquid paraffin is obtained from petroleum. It's a petroleum product from the mineral, and of course lithium used to treat psychiatric disorder. All of them are obtained from minerals. Then other source is a microorganism. So all the antibiotics is used to treat the infectious diseases. For example, penicillin was the first antibiotic found out by Alexander Fleming. It's for bacteria. But nowadays, again, all the antibiotics, almost all the antibiotics are synthetic. Natural antibiotic we don't have much because of a lot of bacteria and fungus, they develop resistance to the antibiotic. So most of them are synthetic and they are modified antibiotics and antimicrobial agents. So to just to recollect and to know it, microorganism was one of the source for the drugs. Then the synthetic, and I told a majority, example paracetamol, if you name any drug, may be synthetic. Then of course a plant. Still plants are a source of many drugs. Example, morphine, quinine, atropine, digoxin, sterols. So most of them, quinine is obtained from the bark of the cinchona tree, cinchona alkaloids. And you have of course these drugs synthetic as well as natural, but many times even now plants, they are the major source for the drugs. Then the oils, the fixed oils like castor oil. Those nowadays you don't use castor. Those days they use castor oil as a laxative or a purgative, but nowadays we don't use it. But you should know there are sources from oil. Then volatile oils like clove oil, which is used for nowadays dental toothache oil, and this clove oil is obtained from the clove. There's oil prepared from the clove. Then a mineral oil like liquid paraffin, already we discussed, it is obtained from the petroleum product, which is used for by the major. In those days liquid paraffin was used as a purgative, but due to the advent of the new modern medicine, this liquid paraffin has got now a role for the skin specialist for as a local application, but still some preparation we have as a purgative. Then the alkaloids as a source of drugs. So here again the example is atropine, ametin, morphine, and they are the basic substances which are insoluble in water, and they got basically a cyclic nitrogen ring in the structure. Then the glycosides, a sugar plus an organic compound. Typical example is a digoxin, where you get a sugar moiety attached to the organic compound. So again, a glycoside is a source for the digoxin. I'm telling you a few examples. There are a lot of drugs which will be given under various textbooks. You can just refer them. So then the gums, the agar-agar, gum acacia, these are the bulk laxatives that are obtained from gums. So gums is again yet another source of drug. Then the resins. So oxidation or polymerization of the volatile acid, they give the resins. So sometimes the resins has been used in various treatment of various diseases. So the resins are usually combined with an active drug and is given the various formulations. Example, oleoresins, tannins, and some of the antibacterial substances, and they are typical example of this resins. And the next slide is regarding the drug nomenclature. If you take a strip of tablet, any tablet, you can see a lot of names in this. So usually a drug will have a chemical name, a non-proprietary name, and a proprietary name. That is a brand name. So this chemical name like methyl, phenyl, ethyl, or sometimes chemical codes like RO115, 178, a lot of things. So this is a code or the formula that is usually given during drug development. So once a drug is developed, they give a proper name like lignocaine, glibenclamide, amoxicillin, paracetamol, etc. So once they come to the manufacturer, different manufacturer will prepare a different brand name. But the medicine will be because, for example, if you take a paracetamol, the paracetamol base is all same for all the brands, but the brand name will differ. For example, a paracetamol may be called as a metacin, a fepamol, a dolo, metacin, a lot of things. So if you take a strip of tablet, take a strip of tablet in your home and see, and you can see all these small, the pharmacological name will be written as a small name, small, but the brand name will be written a big by the manufacturers. So you should read both the pharmacological name as well as the brand name. So that's how the drug nomenclature goes on. So usually you have a drug inserts on all your strips saying the drug nomenclature, everything about pharmacology of the drug. So next is orphan drug. What's an orphan drug? Orphan drug is a drug which is used to treat rare diseases. Here, for example, I have given two. One is sodium nitrate and digoxin antibody. Sodium nitrate is used to treat the cyanide poisoning, and digoxin antibody used to treat the digoxin overdose. So these are very rare condition, and this drug is not freely available in the market. You can't just go to the medical shop and get a sodium nitrate. These are usually available in higher centers, and no manufacturer company doesn't care about this orphan because it doesn't yield them more profit. So they are usually manufactured only by small number of drug manufacturers, only on demand, and these drugs are mainly available in the higher specialized center. So since it is not cared by most of the pharmaceutical industry because they don't give them a profit, we call it as an orphan drug. So everyone, with this we end up this video, and again I am here, Dr. VR.SUBBIAH, Senior Consultant Diabetologist and Professor of Pharmacology. And if you really like my video, please subscribe it. Don't forget to press the bell button, and if you really like it, make a like, share it, and make a comment. That gives me more encouragement to send you more and more videos in this pharmacology. Till the next video, I'm saying goodbye.